The Reproductive Medicine Educational Series presents Endometriosis, prepared by Dr. Paul Robb, compliments of ReproMed, the Toronto Institute for Reproductive Medicine. What is endometriosis? Endometriosis is a condition where the lining of the uterus, the endometrium, grows in other areas. This can include the lining of the pelvis, behind the uterus, around or in the ovaries, or in the fallopian tubes. This tissue, similar to that in the uterus, grows and then bleeds throughout the cycle. It can cause pelvic pain, usually around the time of the period. It can cause adhesions and scarring in the pelvis that can affect fertility. Even without adhesions, fertility can be lessened. How common is it? It's difficult to determine due to the fact that some women have no symptoms. It's estimated that 10% of women of reproductive age have endometriosis. Of women affected by infertility, between 20 and 50% of these cases is a result of endometriosis. What are the symptoms? Pain. This can take the form of painful menstrual periods. That can be prolonged throughout the entire cycle. There can be painful intercourse, as well painful bowel movements or urination. Infertility or subinfertility is another symptom. Others include fatigue, diarrhea, constipation, and bloating or nausea, especially during the menstrual periods. What causes endometriosis? It's unclear why some women get the condition. There are different theories. It's likely that some of the menstrual blood and uterine lining fragments go backward out through the tubes and into the pelvis. Most of the time, this does not cause a problem, but for some women, this tissue can attach and grow in the pelvis. Each month, this tissue grows, then bleeds, causing inflammation that leads to pain and scarring. Likely, there is a genetic component as family members of women with endometriosis are more likely than others to have the condition. Women with reproductive tract abnormalities are more likely to have endometriosis as a result of more backflow of menstrual blood through the tubes and into the pelvis. How is it diagnosed? Symptoms provide a clue. An ultrasound showing a certain kind of cyst may further suggest endometriosis. To formally diagnose it, a laparoscopy is needed. This allows for the pelvis to be inspected and biopsies to be taken. How is it treated? For those looking to address symptoms of endometriosis but are not looking to achieve a pregnancy, may consider the continuous use of birth control pills, using a progesterone medication by itself, using a GnRH analog medication like Lupron to shut down the ovaries, an intrauterine progestin releasing system, pain medications, or surgical options. For those looking to achieve a pregnancy, options include ovulation induction or IVF with or without surgery. For more information on this and other reproductive services, visit www.repromed.ca. ReproMed, helping dreams come true for over 20 years.